receive a follow-up email in the next couple of days with a link to the webpage where all webinar recordings are housed, as well as a link to our upcoming webinars. We have webinars planned out through October 2020, and many are open for registration. All attendees are in listen-only mode. Please type your questions in the chat box and they will be answered in the order they are received. If we run out of time and we still have questions, responses will be sent directly to the person asking the question by Christine. Professional continuing education credits and AIA CLUs are being offered. For AIA certificates, please send me an email at Billie, B-I-L-L-I-E, @appa.org with your membership number. If you did not indicate you wanted a certificate at registration, just send me an email as well. Also, if you have more than one person attending this session from a central location, please contact me so everyone gets credit for attending. At this time, it's my pleasure to turn this over to Christine Messina. Christine, take it away.
Thank you, Billie and APA, and thanks to each of you on the call today. I understand from Billie that more than 450 of you are here with us, or have at least registered. You may be diverted on some coronavirus planning. And that big registration number tells me that A, mold is a very popular lunchtime topic. B, you're really interested in those 5 AIA credits, or C, a little bit of both. I'm going to go with a little bit of both. If I had an alternate title for today's program, Developing Mold Literacy, it would simply be this: what do each of you know about mold that you need everyone else to know? Literacy is, of course, defined as having competence or knowledge in a specified area. My question to you is, who do you consider to be mold literate? Who has mold competency and knowledge? And I'll follow that up with the $64,000 question. Is there a benefit to you to promote increased mold literacy across departments, faculty, students, and families? Now, you've heard about the symptoms that mold can cause, and I'm sure that mold has given you a headache or two. And since we are having a lunch and learn, perhaps a little indigestion. So I have selected the ultra strength here, knowing that in 2018, it was a particularly potent year for mold, leading to situations that looked like this. Now, the good news of this slide, and yes, there can be good news, this is not the causation of mold that you are facing in your facilities. The backstory of this image is one of pure neglect. This piece of property was in the midst of a real estate transaction. It was unoccupied, unmonitored when the roof blew off. Water infiltrated the building. It went unaddressed. The building was not dried down. And of course, the mold that was already in the environment grew on the building materials to this extensive degree. Again, this is not the type or the cause of mold that you've been facing, but I share this image because mold is such an emotionally charged word in our culture. I wonder if when the public or the occupants hear that word, if they leap in their minds to an image like this. Now, in 2018, we know it was a record year for rainfall, and that was a big contributing factor to the extent of issues that you all were facing. Here in this slide, we're looking at Washington, D.C., but for those of us in and around the area, all around the country, 2018 was a record-breaking year. So when you combine that record-breaking rainfall with the excessive heat that is typical of August move-in timing, it is easy to see how we start to develop the perfect storm factors that lead to a headline like the one in your lower right-hand corner. But we have to ask ourselves, no one here on this call can say that your job today is easier than it was 10 years ago. Is there something about the cultural shifts in our society, like the weather, that is impacting the intensity and the degree of difficulty you are having in managing mold? So let's take a look. We absolutely live in an immediate gratification culture. We can, with one swipe of our screen, have an Amazon package delivered same day or next day. We live in the information age. For some of us, we've arrived into the course of our careers, but for the folks that you're serving, and particularly the students, they've been born into it. And what we need to realize in the context of this topic is that just because information can travel quickly because of the technology at our fingertips, it does not mean that we have a quality control monitor in place to determine its accuracy before that information is shared. So much so that dictionary.com named its word of the year misinformation. And we know that mold fears trade on misinformation. So what else? I think this is something that will resonate with a lot of the experiences that you're having. Euromonitor is a global market research firm that tracks trends in consumer behaviors so they can feed that information back to businesses so that they can better connect with potential buyers. So Euromonitor named its trend of the year in 2018, the year of that record rainfall, call-out culture. That is to say that it is socially acceptable to complain about a person, place, or event online. So that leads us into, that commonplace practice leads us into the 4 stages of a mold event. First, we have our initial discoveries. One complaint, then another area of concern, and then clusters start to develop. It's at that point that the institution may decide to bring in an outside consultant. This will take a couple of days. The consultant will do their walkthroughs, conduct their interviews, proceed with their investigation, and after they collect enough data, present it to you, and then you will have the difficult decision of closing off some areas, potentially relocating occupants and residents, and that's when the communication from the institution really starts to ramp up. As soon as that difficult memo goes out, letting people know that they're going to have their routines disrupted and be inconvenienced, that's when the chatter really starts to begin. At that point, when people are informed, that's when, again, it becomes socially acceptable to go online, go to their social media channels, develop their hashtags, and complain about their experience and inconvenience. Once the remediation takes place, that is when the institution vows to be more proactive and make declarations about what we will do better to prevent this in the future, how we're going to revisit our protocols and become better at preventing and responding to mold. The issue is that all of that communication runs parallel to the event. It's event-driven in stages 2 through 4. And the reason that is a problem is because when an institution vows to be more proactive, it sounds reactive after the fact. So what we've learned, the takeaway from this, is that communication is an important tool in the awareness and the prevention of mold. And it really needs to be front-loaded before there are areas of concern or bigger incidents of any size. And the way to do that is through building awareness, creating teamwork around this issue, and increasing training. The other really big lesson learned of 2018 is the importance of getting ahead of that excessive humidity and to get ahead of it with equipment in place. So dehumidification contingencies are a big lesson from 2018. We know that you're working with aging infrastructure and there's not always a budget for deferred maintenance in the way that there's a budget for new buildings. But with this awareness, we have to have a plan for dehumidification in place. So how can we put all this together into an actionable plan? So we've broken this out into 4 sections. The first is to make sure that your institution is the place that folks go to when they have questions, when they're looking for information, accurate information on this topic. You don't want people going out into the interwebs or sharing information that's inaccurate over social media. So how can your institution really be a resource in advance with regard to mold? And then we'll take a look in the second session at your mold management plan, what those components should be. If you have a plan, that's great. Let's meet the plan where it is. If it's something that you're building, this will be a great place to start. Then within that plan, training is going to be really important. So we're going to break out training for staff and occupants. And I think that's where we'll find something new in terms of the way you've been dealing with this. There may not be a lot in terms of student, resident, faculty education, so we're going to focus on that. And then taking a look at the witching hour. How can we create enhanced protocols surrounding summer, which is a typical challenging time, periods of vacancy when you're off for semester break, or periods of extreme weather? So let's dive into the first section. If you believe that managing mold is just as much managing a people issue as it is a building issue, then we have to take a new look at how we're handling this. So we've all heard the old adage that mold control is moisture control. What today's discussion will do and challenge that and say it's just not enough to win the day. Mold control is accurate information control. And for those of you who've weathered a crisis, whether it's specifically mold or other events on campus, you know how difficult it is to become the digital content creator or the crisis communications point person in the moment. So much of this material can be gathered in advance. So a big mission here in being the resource in advance is to unseat and displace who's been owning the narrative on mold for decades now. And clearly it's the media. The media has had the ability to, almost unchallenged, have a voice that demonizes mold, makes it scary, trades on people's fears. And really, you're the expert on this issue. You're the expert on your campus, on your buildings, and you're able to separate the mold fears from the mold facts. So the place to do that is on your platforms, and you have so many assets available to you. You've got your website, you have your environmental health and safety pages, you've got residence life pages. And I get it, I understand that the students, the public, are not reading the website as a course of their daily actions. However, you have a way to push that content out through text, through the social channels of your institution. It's just a matter of asking for a little airtime to be able to do that. So again, you want to be the source for providing the mold facts and frequently asked questions. The importance of doing this is we have to discuss the risk in a visible manner. Again, the goal here isn't to just be transparent, but rather to be proactively visible. This will give you your chance to promote those tools for awareness and prevention that we're going to talk about a little bit later. And really important, this is a way to perhaps limit some self-investigation. I'm sure many of you have had to bear witness to students who are taking registers off the wall, taking photos, taking video, that type of activity. So we want to be able to, again, be a credible source so that you can demonstrate your competency with this issue. Now, where are you going to source that material? With so many ulterior motives, and again, that quick transfer of information and potentially misinformation, you want to have a true north alignment. You really want to be grounded in the credible sources available to you. And they are the EPA, the Centers for Disease Control, the American Industrial Hygiene Association, and your local Department of Health. Now, if I had a top 10 facts or top 10 pieces of content that I think really help to reframe this issue and create a new mindset and get some important points across and do some myth busting, here they are. Number 10, mold exists outdoors and indoors. Zero spores should not be the goal. Working in living spaces are not sterile environments unless you're working in a hospital or a lab. Presented as a true or false question, if you were to ask folks, are you breathing mold spores in right now? They may or may not get that wrong. So that's a great place to start, is for people to understand that mold is already a part of the environment and you're never going to get rid of all the mold spores, nor should you. Number 9, mold issues indoors can occur in degrees of severity. Many times, all that's required is a thorough cleaning with a mild detergent and drying. This is the opposite of what people conjure up in their minds when they hear the word mold. They think of something that is much more invasive or threatening. When you and I know, housekeeping, your custodial staff, you're cleaning up minor incidents of it all the time. Number 8, this is a pet peeve of mine. The term toxic mold has been used over and over again in the media. Why? Because it grabs a lot of attention and it can help to sell some airtime. Toxic mold is a term that is not supported by the CDC. So when you're loading in those mold facts and mold FAQs, you really want to make sure that you include this with a link to the CDC as well. Not all mold that is dark in color or is black mold or Stachybotrys. This is huge. Part of the challenge that we're having with early discovery is that mold suffers from misidentification. People hear the word mold and they think of something that is black, dark green, colonized, spread out, over several square feet on a wall. Whereas looking for white mold is really important. This is something that we need to train to. So if you're taking notes on this call, this is something that you want to underscore, whether it's housekeeping, custodial, any of your folks who are performing maintenance or inspecting your spaces, you want them to know that mold in its early growth stages looks fine, white, and powdery, and is often mistaken for dust. So I'm showing you 2 images here that if they were not illuminated, taking a look at the underside of that drawer on the left, you would not know that there's any growth there at all, and you might just mistake it for dust. So this is something that we're going to come back to again. Moving on, number 6, all molds to include Stachybotrys are remediated the same. Again, folks hear Stachybotrys or black mold and they think that there is a stepped up level of threat. And when it comes to the different species, that's a detail that we could get into at another program. The point is folks react individually. Folks could react to dust just as much as they react to mold or not at all. But the point is the efficacy in mold remediation is in the removal of the spores. So it doesn't matter if it's penicillium, cladosporum, Stachybotrys, the removal is the key. And while we're talking about this, just killing the mold spores, sometimes I hear about fogging, which is something I don't condone. That's not enough to reduce the allergen. A dead spore is still allergenic. Number 5 and number 4 go hand in hand. Again, if you're taking notes, this is a place that folks just aren't informed about. There are no laws established at the federal or state level. There are no established standards or threshold limit values, TLVs, for airborne mold because mold is an allergen. This is where the gray area comes from. I understand, especially in an academic setting, it's so tempting to want to have numbers and benchmarks and have those numbers be actionable. But the reason there's no laws and the reason there's no standard airborne exposure limits is because this is an individual basis for folks reacting to allergens in a different way. So that's why it's so important to rely on the sound judgment of your partners in the environmental space and the knowledge of your own institution, because it's not a black or white issue. A judgment call is going to be made sometimes, and that's why trust in those partnerships is so key. Number 3, reaction to mold is on an individual basis and ranges from no reaction, we don't hear that or see that published very often, to allergy-like symptoms, to, in rare cases of the immune-compromised, more serious illness. Are there health concerns surrounding this issue? Absolutely. No one is denying that. And again, you can include that in your facts and FAQs. Likewise, what I would also include there is if folks are experiencing symptoms and an investigation determines it is not mold, what are the other possibilities? And you can have that list of other allergens. Is it dust? Is material off-gassing? You want to provide people with information about what else in the environment might be triggering those allergy-like symptoms. And just about anywhere in the country, you're going to have a challenging allergy season. All right, number 2, I took a creative license here. I wouldn't call this a fact, but it is an opinion, and it might be an opinion shared by many of you. The media's investigative tone promotes an us versus them adversarial dynamic, amplifying fear and undermining trust. And because I've been focused on this point, talking about how you can become a resource, how your platforms can become the voice and narrative on being proactive about mold, I want to show you an example of how one of your institutions is introducing this topic on their environmental health and safety page. I want to thank Paul Muldoon from Penn State, who provided me with the permission to use this slide. Mold is a simple plant-like organism that exists everywhere. There's a great deal of information available about mold, much of it wrong or designed to alarm people unnecessarily. This strikes the perfect tone, and I like what they did here. This is what I call using the force. They understand the mindset of their constituents. And just like the media gets to have its moment and strike its emotional chord to try to leverage and get people to buy in, I love the way that Penn State has neutralized that here with their tone. So this is a great example and really well done. All right, finally, facts that you want people to know. Here it is. This is, I call the grand enchilada. No HVAC system was designed to address the excessive and sustained level of humidity fueled by the record rains and heat of 2018. I wish I could shout this from the mountaintops on your behalf. This can no longer be a best kept secret. It's too great of a burden or a problem to solve without bringing other people into the solution. So in terms of solutions, as I said, I wish I had a way to wave a wand and increase your maintenance budgets on the older buildings that you already have. But absent that, we know that facility professionals can never rely on any reasonable excuse to not get the job done. There's always got to be a way to work around. So with that, we want to place an emphasis on having those dehumidification contingencies in place. This is going to be the game changer. If it's not said or understood enough, mold that is derived from a water source, mold that's derived from a roof leak, is going to be isolated versus when relative humidity exceeds 60% and we get into that danger zone. Now it's a hospitable environment for mold to grow, and the spores that are already there are starting to multiply and land on surfaces that are damp or have condensation because there's so much vapor in the air. That's when we get humidity amplified mold. And the extent of damage and the remediation costs and the disruption that ensues is tenfold versus dealing with an isolated incident. So if the name of the game is making sure you're not in that danger zone of 60% or over 60% relative humidity, and your HVAC system isn't keeping you below 60%, now it's time to troubleshoot. So in the time that it takes you to make that service call, maybe you're waiting for a part, you have to have a way to back yourself up with supplemental dehumidification. Sometimes it's not that the equipment isn't operating properly, getting back to the tail of 2018, it's just that it's been pushed to its absolute limit and it cannot keep pace. If it's August and it is the 5th day of 90+ degree heat and it is 90% absolute humidity outside, there's no system that's going to be able to keep up. It's going to limp along. And your ability to test relative humidity, see where you are, see that you're above means it's going to be time to bring this equipment in. Another reason that you're going to want to have dehumidification on hand is we said that mold control is moisture control, but sometimes we're controlling the moisture in the building because we're introducing it to do our cleaning and maintenance activities. So whether that's stripping and waxing floors, shampooing and extracting carpets, even painting. Paint is a water-based product. So if we're painting walls, we're introducing that extra moisture into the air, that's something that we have to consider. So it's okay to do those activities. They just need to be done in concert with dehumidification, with knowledge of the indoor environment. And what I would suggest in those instances, because this is something that we see people trip over and again, is to have dehumidification in place in the space where you're going to be doing those activities a day before the work is performed, the day of work being performed, and I would say even a day after. All right, moving into our second session, your mold management plan. Mold management is a team sport. I do hope after today's program you will see that it's valuable to draft more players. Your mold management plan is your playbook. So I've listed some components that should be included in your plan. Right up front, the purpose and rationale. What you want to include here is how common of a building risk mold is, and to place a focus on humidity. Again, as we said, water-based mold incidents are going to be more isolated, whereas humidity-amplified mold is going to be much more extensive in scope, cost, disruption. So you want to make sure that that word humidity is included as a risk right up front. Again, if you're in the business of managing buildings, you're in the business of managing mold. You'll also want to include responsibilities by stakeholder. So this is where you're going to demonstrate the flow between titles and departments. So when a complaint comes in, how does that travel through the conveyor belt? Where are the handoffs? Where's the decision points? So that you make sure that a complaint, an area of concern, is either verified mold or it's verified as another issue and that it's closed out. In the plan, obviously, you're going to include procedures for prevention, reporting conditions, response, and remediation. Prevention we're going to talk about in this section, and then we're going to go into a little more detail when we get into education for occupants. Reporting conditions, here's where you want to include some new language. With so much emphasis on water, you want to make sure that you're shifting people's focus to other building conditions that are markers of excessive humidity. So you want to use language like condensation, noticing sweating pipes. This is really important because we're going to shift people's focus from water to humidity. Okay, here's a big one. Testing. In the plan, you want to have a statement about testing, when it's utilized, and what its limitations are. In an academic setting, folks are going to look at testing as, do I have mold, do I not have mold? And we all know the story here. Once you test, you own those results. And that's not a bad thing. It's just really important that it's delivered in a context where the spokesperson can provide the proper interpretation. And we'll talk a little bit about why testing results can vary and why they are limited in its ability to tell an accurate story. Testing is just a snapshot in time with a lot of variables. You'll include the health concerns, again, repeating that there are no laws and there are no acceptable threshold limits, but that you are using the best governing agencies available to you, as is the standard in education and in other markets. Now we're getting into prevention, education for employees, and that will include residence life, RAs, what type of information you include in your orientation, in your handbooks, in your refresher training. Same goes for students, and as I said, this might be a new area that hasn't been quite introduced yet. And of course, a rationale for revisions. This is a living document. Your mold management plan is a living document. Prove that it is when all eyes are on this topic. So if it's been some time, take the plan out, have a reading around the table, and make sure that you are noting those edits with a date and time log. Now, you all are acing mold awareness, mold prevention, mold protocols when there's an active leak. You're looking at a chiller break here, and when this happens, there is no gray area. No one's standing around wondering what's their next move. The protocols and the procedures for response are baked right in. We know that if we don't extract water and dry down within 24 to 48 hours, mold will grow. Where we really need to take this conversation relative to training is, it's great to keep this awareness of water, keep all that going. You're doing a great job. But can we make those less obvious factors just as reportable and just as urgent as water? So what we're referring to here is, can we make it routine to document what are those hallmarks of when relative humidity is becoming a problem? So one, just having the equipment to test for that and see if we're over 60%. In our inspections, are we noticing that there's condensation, sweating pipes, cold surfaces? Being more aware during times that you might have subcontractors coming in. Down at the bottom there where it notes renovations and temporary barriers. This is a time when the building envelope is being opened. You might have weather coming in that you did or did not anticipate. If those temporary barriers are shifted and you have heat and humidity coming in or possibly water intrusion, these are the things that might not seem as active and in your face as that chiller break, but they really do need to become those more actionable, we'll say, guideposts for where you could be getting into the trouble zone. So again, this is a place in training that we want to bring people's attention. All right, so I've mentioned training a few times now. We're moving into the third section, training for staff and occupants. Your staff are your returning players. I do hope that you will enlist some new recruits in the form of other staff, other departments, faculty, and certainly your students and residents. Now, an easy way to disarm folks who may, when it comes to this issue, have some mistrust or skepticism, and I know just from reading a little bit of the headlines out there that this is a reality that you're dealing with. Sometimes the occupants don't trust that you have the same sense of urgency. Sometimes they don't trust that you're giving them all of the information. There's that sentiment that, an institution or any organization is trying to hide something. This very simple campaign and training for staff and occupants disarms all of that. So simply put, if you see something, smell something, say something, we can't spell success without you. Thanks for being a part of our indoor air quality team. So when you invite your occupants in this manner, it does make them a part of the team. It does give them a voice. You can reinforce that number or that first channel for issuing a concern. And then in the upper right-hand corner, we're doing that training that is so important about the proper identification of mold in its early growth stages. So it simply says, did you know that mold in its early growth stages can look white and powdery? Not the stuff you typically would depict. Surfaces under tables and desks are darker and are a hospitable environment for mold to grow. Here's where we're getting to what we like to call a 360-degree inspection. We have to place our gaze, place our attention on the places where we know that mold likes to grow. So when we walk into a room, that's not the naked eye. It's not just the surfaces that we can see without bending down and taking that 360-degree view of the contents. So how do we address visible mold under 10 square feet? This is a question that we get all the time. In your training, you should have a module for your custodial staff, for the folks who are performing these activities, where whether you're following the EPA's breaks for under 10 square feet, or perhaps your institution is training for under 30 square feet, whatever it is, make sure that in your training, you're making the proper PPE available to everybody, that you're reinforcing the basics, the fundamentals, that in their cleaning, the rags that they're using are going to go into a plastic bag, gooseneck tied, duct taped, so that when the spores on those rags are going outside of the area, you're not cross-contaminating, you're not spreading spores throughout the building, and they get disposed of outside. The use of a mild detergent versus bleach or biocide. I'm not sure if this is something that you're still running into, but with humidity amplified mold, when mold is derived from a clean water source, as humidity amplified mold would be, we in our daily course of business use a very mild detergent. We use Dawn dish liquid. So if you're running into a situation where folks are looking for something stronger, there are plant-based disinfectants out there that you might want to consider. The reason we don't encourage bleach or a biocide, again, gets back into a couple things. One, the EPA is always going to recommend using the most mild product. Two, your occupant might already be complaining of symptoms or concerns like headache, runny nose, so you don't want to introduce anything stronger into the environment than you need to. And the reason you don't need to introduce anything stronger is what we talked about in those facts. The real efficacy in mold cleanup, in mold remediation, isn't just in killing the spore, but rather in the successful removal of the spore. So if you're doing that handiwork, you're doing the proper cleaning methods, you're not going to need to introduce a bleach or a biocide. Getting to training, an area where it would really pay dividends. I'm not sure how much customer service training you might introduce, again, whether it's while you're onboarding a staff member or if you're including it in your training modules. But because mold is such a high touch issue and you're sending your staff out there to answer these complaints, it would be great for them to have a little more training in that area. How do you deal with a disgruntled consumer? How do you increase your listening skills so that no matter their concern, you're successful in having that exchange where they feel that they're really being listened to? A place where we see people get caught up is when there's a gap in the response time. So having a system in place where those areas of concerns or complaints are flagged with an urgency, I would say in this day and age with the focus on mold, you would want to aim to respond to a complaint within 24 hours. You want to make sure that you're consistent in that. That's another important part of the training. And also just having a few scripted points. The person who goes out first is likely going to be asked, are you going to test? So whether it's on your environmental health and safety page policy, or you're able to provide those scripted points, you want those folks to be able to answer that, or at least to be able to say, that's a question for my supervisor. I can tell you from the little bit that I've learned about the litigation that ensues when folks want to take their complaint even further. It's hard to prove bodily harm with so many other environmental factors, but it's very easy for someone to prove that there was a delay in response. So make sure that you're really buttoned up on that side of things. All right, so tools of the trade. When we show those images of mold in its early growth stages, the importance of having that flashlight is that you're not going to see it without the illumination. So these might be tools that you already have on hand for your staff, but that you'll want to consider increasing. Moisture meters are stock and trade of what we have on hand. Hopefully you do as well. Again, it might be something that you might want to increase. So to drive that point home a little further, we've got two images here. On the left, this bookcase is not illuminated with a flashlight. On the right hand, it is. And now it becomes easier to see where the mold is growing. Closets are an area that you'll want to bring up in your refresher training. It is so easy to go into a room, take a look around, and not open that door, or open the closet door and not illuminate it and not see that because a closet has everything mold wants. A closet is the Ritz-Carlton for mold, I'd like to say. It's got all the great hospitable factors. It's dark. It's got poor to little ventilation. The custodial closet is going to have a water source and wet contents. And now, again, we have all the puzzle pieces in place for mold to grow. So make sure that as you're reinforcing that 360-degree inspection, you're also placing an emphasis on closets and tight spaces. Okay, moving into enhanced break protocols. Mold has a witching hour, and you can neutralize it. Just a few more pieces of equipment here. And a little case history. I jumped ahead a little bit there, pardon me. So this is an example of where facility management was doing all the right things. Basements are inherently at risk. They're below grade, and to the credit of this facility department, they had relative humidity wall-mounted devices in place. Unfortunately, whether it was miscalibrated or malfunctioning, we don't know. It was not reading that relative humidity was exceeding 60%. But what did become apparent is the mold that started growing on contents like the duffel bag that you're seeing on the left-hand side. So if you think about the day in the life of this duffel bag, it's going to go outdoors, probably land on a field somewhere. It's going to be on the quad. What does it have inside? A wet jersey, sweaty pads from whatever sport, and the mold spores that are already on the ground are going to hitchhike, attach themselves to the duffel bag, and then where does the duffel bag go? Into a closet, onto a rack with poor ventilation. So surface mold, as we said, is indicative of humidity amplified mold. And we've got a reading here of our own device that's showing it was unfortunately over 67%. So you'll want to, where you have those wall-mounted devices, make sure that you do have a backup in place to check it with a handheld device. More tools in the battle against mold. We've got a way, I'm sure some of you have better, heavier duty thermal imaging equipment on hand, But if you wanted to put more tools in the hands of your staff at a friendlier price point, there is a way to do that now. FLIR One makes makes an attachment for your cell phone, and you simply download an app, and you have the ability to turn your smartphone into a thermal imaging device. So as most of you know, or all of you know on this call, it's not that it's going to give you a reading about moisture levels, but rather it's going to show you temperature differences. Those temperature differences are your clues to water pathways. All right, educating your new recruits. We said we wanted to expand the mold awareness and mold prevention team, and that's why we're going to invite students into this conversation. Here we have a happy picture, fresh faces ready to move in. It's probably one of the hottest days of the year. And what do they have in their cart? A lot of stuff. They've gone to Bed Bath & Beyond. They've maxed out their big blue coupons. They can't wait to make their Pinterest dreams come true and decorate their room. Now, here's what a typical dorm room looks like. This is its best chance to ventilate, right? So you've got the closet doors open. It's just the furniture. There's no stuff yet, but we know that this is not what rooms look like in reality. Reality looks something more like this or like this. So when I see this image, and when you see this image, I see a lot of risk factors. And this is what we need the residents and the occupants to see. We need them to see what we see. So starting with this area between the bed and the window, it is possible that they've got an air conditioning unit that they are putting down to meat locker temperature, but it's 95 degrees outside, and that's going to create a temperature difference that creates condensation on this window. As that vapor turns into liquid and drains down, it's getting trapped between the curtains and the bed. This person has their Tostitos right here. I didn't notice that the first time. I will say they did a good job here of at least separating the desk and the bed, but the desk could be pulled out away from the wall a bit more to, again, promote better airflow. This under the bed storage is something that I know space is a premium. It tends to get encouraged. I don't think this is the best idea because it's blocking airflow. Carpeting. I know it's great for noise reduction, but it is a place for more water and moisture to get trapped, particularly if somebody's throwing wet clothes and wet towels on the floor. So this gets tricky because I'm not the first to tell you, these kids probably didn't learn to clean at home. If there was a wet towel on the floor, I'm guilty of this, even though I tell my kids 5 times, mom's probably picking it up. But here in their very small ecosystem, in their very small environment, they need to control the indoor environment as well and understand the consequences of when they don't. So being able to point out these things as a way to change their habits in the spirit of better indoor air quality is the way to go. All right, so we talked about launching a See Something, Say Something campaign. We've got a very simple protocol promoting the 3 C's. That's communication, climate, and cleanliness. We're going to come back to that in a minute. Sharing with residents how to identify mold. We've placed quite a bit of emphasis on that, where to look, underneath desks, underneath drawers, in between tight spaces. Don't overstuff shelves, don't overstuff closets. What are the conditions to report? There's going to be signage everywhere about if there's a water leak, report it immediately. But let's shift those conditions to report to the hallmarks of humidity. So excessive humidity, vapor, condensation, etc. What can they expect in a response? This ties back to your mold management plan that talks about when a complaint comes in, how does it travel, and ties back to your policies in residence life. Here's a big one that I don't think enough of you are engaging in. Take credit for the routine prevention you're doing all year long. Let the residents know you're preventing mold every time housekeeping is cleaning, every time they're dusting. Explain that when your staff is using a HEPA vacuum, they're doing that because that is what is pulling the spores and dust and particulate, 99.9% of the particulate out of the air. So that's all great prevention that you can really take credit for. Even addressing minor work orders quickly, addressing those water leaks quickly, that's all mold prevention. Here's a picture of data. The reason I included this is a great time to get the parents involved on move-in day, share some of that literature about tips for prevention, because you can count on mom and dad to keep reinforcing that all year long. Again, here are those 3 C's: cleanliness, climate control, and communication. More campaigning, just letting them know that if they can reduce the contents they're bringing in first semester, not bring everything for the whole year, that will save space, promote airflow, keep their contents dry, don't hang wet towels in the closet, and promote airflow by pulling the furniture back, pulling shelving out, etc. A real low-tech piece here. This is a product by Arm & Hammer. If closets and cramped space are a concern, this is a way to add a little dehumidification without adding some equipment. And quickly getting into our last section here, I jumped the gun earlier. You don't have to be surprised by when mold becomes a more difficult challenge. We know it's when the summer months and August move-in timing coincide. So you got to get ahead of that high humidity. So it's time to review the plan. As I said, I don't think anyone came to this call without one, but let's pull the plan out and align it with your current situation. Identify the resources needed. Nobody wants to think about a worst case scenario, but if a dorm evacuation is necessary, if a relocation plan is necessary, have that conversation with risk and finance in advance. What does that look like? Who are your partners? Where's the nearby hotel? How would that work? Here is job number 1, and I think many of you have already engaged in this. You've got to take a look at your inventory and decide which buildings are going to get by with short-term repairs, which ones will perform well enough in normal seasonal temperatures, but when they get pushed to their limits, can't do any more to pull the humidity out of the air. That's not what air conditioners are designed to do. So where will you need, what buildings are the candidates to have those that dehumidification equipment in place, where you might have to buy more, and of course the toughest, where are the bigger budgets needed, where are the permanent repairs needed. I think a lot of you are in the bucket of, you've got a list of buildings that are on deck to be renovated. In the meantime, you're going to be doing a lot of these workarounds and a lot of education to get by. So knowing that getting ahead of the humidity is the name of the game, and knowing the indoor climate, knowing the relative humidity, what will trigger mold watch? Will you have some type of indicator internally that says when we get to this degree of heat, this degree of absolute humidity, we're going to be doing daily inspections, and will you need volunteers to get that work done? How can we use checklists to promote the 360-degree inspections? And I'm going to toggle quickly to a few resources. So bear with me while I get to those. Here we go. I'm going to go first to a website that I wanted to make sure, Billy, as we wrap up on time, that I make sure that we show this great example. We've been promoting this whole program, the importance of integrated communications. So again, with the University of North Carolina's permission, I'm bringing you to their EHS page that has a wonderful introduction. As you can see here, it says what to do if you suspect mold. It takes you right through an occupant diary, frequently asked questions that talks about if I have a concern, where do I go? And in this instance, they're mentioning that if you have a health concern, you'll begin your process with the health clinic. So all kinds of great resources here. And what I want to demonstrate to you is how they are then integrated with residents' life. So if you go here where it says promoting healthy living conditions, that's going to jump you right to the residence hall and residence hall policies. And here we've made mention of the 3 C's. What do students need to know? Cleaning, climate, and communication. Within communication, they're providing all of the proper channels, the proper steps to reach out to that correct department and initiate their process. And then getting back to those checklists, I'm going to bring this up. This is from the National Institute of Occupational Health and Safety. And within this document, which Billy knows as I did last time, I sent a few key pieces for actionable follow-up. I'll make sure that I include this as I scroll down to the checklist. But this is great because the work has been done for you. You don't have to devise the document. You're seeing it here in its portrait orientation instead of landscape. But this gives a great starting point for folks, whether they be in housekeeping, custodial, maintenance, to go in and out of several spaces and be able to notate, are there damage staining? Is there visible mold? Are there areas of concern? Is there dampness? And that way you've got a documented record of what you need to prioritize and go back to. So Billy, I'm not sure how I kept it to an even 45 minutes the first time. Are you still there?
I am here, and you have lots of questions, and we're running up on the top of the hour, but I have been forwarding these to your assistant, and just want to let everybody know that Christine has the questions. She will be reaching out to you with answers. This recording will be put on the Apple website, and if you just go and do a search for 2020 archived webinars, you will get, you can download the recording, and I will have the slides and the special attachment available tomorrow. So for everybody. So I want to thank everyone for taking time to listen to this very important webinar. Christine, as always, fantastic. And I hope everyone has a healthy and safe weekend. Just be diligent with this coronavirus that's out there. Thank you so much. Have a great weekend. Bye-bye now.